Welcome to another podcast conducted by me, Dan Cooper, the CEO and founder of Rock Investments. This is the Return on Character podcast, where we get to interview people that think that character matters and have awesome stories that oftentimes inspire us and make us better. Today, I'm thrilled and honored to have Adam Hansen, the CEO of Genio, with us, co-founder of this company that I know nothing about. And I know nothing about the category because I know it's in genetics. That's part of the reason why I'm most excited to have you on the show today, because it's an area in the world that we haven't gone yet on Return on Character podcast. And to learn about it from you is a gift, but also to kind of maybe have a discussion about it from a standpoint of character and how that might apply in your field would be great. But welcome, Adam. Thank you for being with us.
Yeah, Dan, thanks for having us. It's a pleasure.
It's nice to have you. Adam, I like to start off with context generally. In context for you, are my guest. Tell me about where you grew up before the show. You mentioned you kind of lived in a lot of really different places. Tell me how you got to Houston, where you're sitting today.
Yeah, I love it. I've bounced around the United States a lot, from Midwest originally. Spent a long time in New Hampshire. My undergrad was at a Brigham Young University in Utah. I've spent time abroad as well. Spent a few years in Calgary, Canada, and we're a global family as well. My wife is from Taiwan, so I spent a lot of time over there. I speak Mandarin. But yeah, I'm coming up on 7 years in Houston now. Hard to believe, time flies. I initially came here for a PhD program in genetics. Houston is actually home to the world's largest medical center. And the genetics department at Baylor College of Medicine is the largest NIH-funded genetics, medical genetic department in the country. So I was really fortunate. They decided to give me an offer for their PhD program straight out of undergrad. So came here in 2016 for that and finished that up a few years ago.
I got to ask the question, did you speak Mandarin before you met your wife, or did you meet your wife because you spoke Mandarin? How did that happen? And Mandarin's one of the most difficult languages in the world to learn. It's pretty incredible that you know how to speak it.
Yeah, it was a journey learning it. I took one semester of a Chinese 101 class, my second semester in college, and around that same time, I was filling out the paperwork to apply to be a volunteer service missionary for 2 years, and as part of that assignment, I was asked to actually be a Mandarin-speaking missionary in Calgary, Canada. And so that was a challenge. I was lucky that I had at least, one semester of a foundation. I didn't even know how to say hi and, ni hao in Mandarin before that. Yeah. But yeah, that was where I got my foundation in Chinese. And I did meet my wife there. Didn't know each other well, but just kind of stayed in touch over the years. And so, yeah, I already knew how to speak Mandarin when I first met her, but obviously being married to her, she's continued to teach me a lot over the years, and she's great. She's my better half. So
yeah, let's talk about a forced language lesson for life, right? I mean, you really signed up for it. That's amazing. And then you kind of casually mentioned that you jumped into your undergrad degree or your PhD program right out of your undergrad. What made you qualified, you think, and what got you that opportunity to start your PhD program?
Yeah, it's a bit of a journey for me. I'd say it started really during my missionary service. It was a pretty formative years for me, and I was just taking a step back and reflecting on life. And I knew at that point in my life that I wanted to focus my career on innovation and entrepreneurship. So I at least had that as a foundation. And taking a step back too, that actually came from growing up in a home where my mother is in healthcare. She was a nurse, and my father was really the stereotypical inventor personality type. He would develop engineering technology in the computer engineering world, and he was able to get some patents for his technology too, and have some small licensing deals, but never really materialized, and never really became a reality in terms of the technology hitting the market and having a positive impact on the world. And so I had that seed of, could say, an obsession, or but really a strong desire to figure out what does it take to actually make innovative technology reality. So uh, I wanted to focus that on a specific industry that wanted to have more focus, and I realized what motivates me the most is to relieve human suffering, and to try to do something to, as cliche as it sounds, but really to help people to have an actual impact on individuals. And with a bit of the kind of healthcare angle, I guess implanted from my mom at a young age, being a nurse, I looked towards healthcare, and was learning about that at school. And I saw this new field of genetics really just opening up precision medicine, genetics. There's an opportunity to use medicine and innovative technology to actually have an impact on individuals. And so, yeah, that became my career mission statement, which I have consistently stuck to over the last decade now, to relieve human suffering through precision medicine. And with the entrepreneurship angle, that really is the path that led me to realize, okay, if I want to have an impact in this space, I need to learn more. This is complicated stuff. And I started applying to PhD programs. I also was able to connect with some mentors and advisors that really were generous with their time, and helped kind of influence my path there. And so I started this PhD program in Houston with the intent of pursuing entrepreneurship afterwards. And in terms of why they let me in, I'm not sure what they what they saw in me at that time. I had pretty minimal research experience, but the training program at BYU was pretty solid in terms of fundamentals and data analysis and genetics. So I I guess that helped me plead my case.
So you enter your graduate program. At the time of entering the graduate program, did you have you still had kind of eyes on starting something, being an entrepreneur, I'm assuming. And so as you were going through the entire process of graduating your PhD, you had that kind of orientation as you were looking at everything. And that led to what?
Led to where I'm at now, eventually, founding Genial, but it led to a lot of friction as well too. Entrepreneurship is not a popular path in academia, in PhD programs, but I kind of had anticipated that going in. So
Give me an example of the friction that happens around PhD entrepreneurials in the biomedical space.
beyond just entrepreneurship too, but really the friction about academia versus industry, and, and kind of the traditional expected path for scientists, for PhD scientists is, just like your mentors in the PhD program, you're going to go on that same path and go into research, and not be motivated by, financial motives, but just to have the desire to learn and discover and be the primary motivation. So that's the perspective of academics, and they see financial incentives getting involved. And just traditionally, that mindset has been that's it's just a different, unfamiliar world to the path that the people who train PhD students are familiar with. But at the same time, there's also a little bit of probably distrust of motives historically, kind of across the table. But, I was aware of that going in, and there was a rotation program, which was great. In the program I was at, we were able to rotate with 3 or 4 different labs, and over the course of a year, before picking one to join for the remainder of our years in the PhD. I just kind of went into that with just really being transparent and not hiding anything at all, and saying these are my goals, these are my motives, and I would love to come in and work hard, but I also would expect support or alignment if I'm going to work with you in terms of supporting this quote unquote non-traditional career path, which is actually becoming more and more popular now in the scientific world, but that's a different conversation.
So then you graduated. What next? How did you go right into entrepreneurialism? Did you do anything in between? How did you formulate to what you're doing today? How'd that come to be?
I was continuing to kind of sharpen the saw during the program as well. T-shaped skill sets. That's something that some mentors that I've had have really emphasized, and that now at Genial we emphasize in candidates that we look to hire too. So what I mean by that is people talk about, whether it's better to be a generalist or to be a specialist, and developing that T-shaped skill set. Well, the top of the T being wide represents being a generalist, having that generalist perspective, but also having a specific area, the depth of the T, that you can come in with a tangible, hard skill set and contribute. And so that was a focus. So for me, the PhD, I knew I was going to get that depth, but I wanted to make sure I was still able to keep kind of increasing my breadth at the top of the T. And so I was fortunate to get connected with a grassroots innovation organization called InVenture in Houston. This is focused on the life science space, and they basically were founded on the premise about 10 years ago that Houston, as I mentioned, has the world's largest medical center, a ton of research talent. But at least at that point in time, there was virtually nothing in terms of biomedical industry, medical devices, pharma. Yeah, hardly, just very, very minimal industry presence, not much industry, not much entrepreneurship. So the talent in Houston, huge talent pool, all focused on academia. Naturally, a lot of them are interested in entrepreneurship, starting companies, innovation, kind of in the commercial space. So the group was formed, and by the time I got involved with them, they had a consulting operation up and running, and I did an internal project with them on business development, and they asked me to lead their commercial consulting program for a year. And so that gave me experience in terms of managing teams. We had 40 consultants at the kind of the peak when I was with them. Got recurrent contracts with Fortune 500 companies as well. And so kind of staying busy, moonlighting on this, with this consulting program that really helped to kind of round out my skill set a bit. And how did I get to where I am now? Right. So the other element that you need is that
You're a consultant, you're getting business experience probably for the first time,
that's
right?
right.
Just
Yeah.
contracts, understanding how the private sector works or big public companies work.
Yeah. Learned a lot about hiring and firing, unfortunately, too, but just how to make those hard decisions. So
Yeah. And so then tell me about the moment you had the idea, the big idea that motivated you to jump away from a secure, safe, comfortable life with a trajectory. And you could tell your wife everything's going to be fine and you have health insurance, and to literally jump off the boat into the big red or blue water.
in terms of the actual research I was doing, my task was I was the big data guy, the discovery person. We had anonymous, so aggregated, anonymized genomic data. It's called exome sequencing data for about 20,000 patients with rare diseases. And at the time, this was the largest of, or one of the largest of those types of data sets in the world. And so my task was looking at just this genomic information. How can we discover new rare diseases from this? And using some new analysis techniques, we did find over 150 new candidate genetic disorders. Okay, we call them candidates. Not quite a full discovery. We didn't, take it all the way across the finish line for each individual one. And that's because we needed just a little bit more data for each of them, a little bit more evidence, which was going to be dependent on re-engaging with those individuals whose data was used for the analysis, right? But again, our data was anonymized to protect their privacy, which is essential. You can't compromise on privacy for biomedical data, especially genetic data, which can even impact family members too, beyond just the individual. So uh, it was great that we can make this discovery, but the whole motivation, right, of the human impact wasn't quite there yet, wasn't satisfied. And so I had one of the two big moments was when 4 years later, after our initial discovery of the first of those diseases, I got a call from one of the medical doctors that we collaborated with. He said, "Hey, one of those families is actually coming through our clinic and finally was able to receive a diagnosis. We found him." And he invited me to go over and to meet with the families. And they were sharing that their son was 10 years old at the time. And he had an intellectual disability and a lot of, severe medical issues throughout his whole life. And they had spent his whole life searching for an answer, trying to find just anyone who could understand what was going on, trying to connect with the community as well. And, they were left in the dark, and in the genetic field, we call this the diagnostic odyssey. 10-year journey for them. When they finally received that answer, they said, "This is a miracle to us. We are so grateful for this." They recognize, they know it's still going to be a while until, if ever in their lifetime, that treatments will be available, but at least just to have that diagnosis was a miracle for them. And here I was in the same room with them thinking, I knew about this 4 years earlier, but had no way to share it with you. And that was, I knew we needed to do so much better for the patients. And it really was maybe 4 weeks of analysis turned into 4 years just because of the current approaches to protecting patient privacy, cut them out of the loop. They really were cutting patients out of the loop in order to protect them. So
there's the inkling of the problem that you kind of stumbled onto, realizing the part. Because we have a dear friend who has struggled with a disease or something that has not been able to be diagnosed for most of her life. And the psychological turmoil that she's had to endure as a consequence of not understanding it, going up doctor after doctor after doctor, showing up, and everyone seeming to think they know what's going on, and then eventually just not knowing. It makes me appreciate the importance of just the gift of just the diagnosis. Like it would be so big to be able to explain why she's suffering, and that's what you saw in that family. It sounds like.
that's right. And so that was, at Genial, we talk about how we're building a private exchange for biomedical data. We connect patients and other data producers like healthcare systems, diagnostic labs. We connect patients and these other data producers with consumers of biomedical data, biopharma innovators, researchers. And we do all of this in a way that safeguards patient privacy, number one. The really problem number two that's interrelated is preserving data ownership as well. Be able to preserve the rights and the ownership over that data. And so that's really the second insight that we had as well, is during the PhD program, it's kind of this conundrum where we're nowhere near kind of satiating that demand for a larger sample size for analysis in biomedical data. We need more data. We need larger data sets. So because of that, kind of the simple solution that people first are gravitating toward is, okay, let's aggregate all this data together. But what ends up happening is there's the patient privacy. There's also data ownership frictions. Groups are investing their capital, their effort, and their lives, themselves into this. And if you just aggregate your data into a black hole or a vacuum that just sucks up everyone else's data, being able to, someone else now can see that data. You really have to trust them to not misuse it. And it's just a huge friction point, basically, where data is incredibly siloed right now because, we really, for patients, we need it to be aggregated, but also for the individual and for the data owner, that kind of goes against their interest too. So
Tell me about your business. What is it that you actually do in the marketplace? How does your business function?
yeah, so how are we solving these problems too, right? And there's this new, really exciting field in the world of computer science called the privacy preserving computation, or privacy preserving compute. And it's an umbrella term, but basically it's really brand new or just arriving in the last couple of years. And now we can have ways to analyze data without actually seeing the contents of the data. We can blind ourselves to the raw data and also blind ourselves to the results of that analysis too. So how do you make any
How does
sense
that
out of it?
work?
Yeah. So how do you see the results, right? What we're doing is we're establishing an exchange, a network where the consumers of data, they can come in and run an analysis or ask for something. And we at Genial have this aggregated database, but it's encrypted. And we can't see the contents. Like I mentioned, we can't see the results, but we run that analysis nonetheless. And with those private encrypted results, now we have to go back to the data owners. They're on our platform as well, and they have transactional level control, whether to approve or decline basically the release of those results on their data. So that way we can enable that connectivity. We can get the benefits of data aggregation, but those data owners, they still own their data. They have transactional level control.
So they can sell their data. Is it offered? Is their data bid on like Amazon, like eBay, or how does it work?
Yeah. So we're still building out the marketplace, kind of the buyer side of it. And we're starting first with data producers, but the model will be that either as an individual or as maybe a healthcare system with a larger set of data, you can either sell individual slices of data, individual level data, or you could rent your data to be used for like more of an aggregate analysis. And both of those routes are possible. And it also really, this is consent, is a huge part of this as well too, right? And so this is the old way of doing things is patients consent. Say, you sign up for 23andMe, and about 2/3 of their customers will just click the little yes, I consent to let my data be used for research. But after that, you lose all visibility. You lose all you don't have any transactional level visibility, let alone control, let alone receipt of compensation for when your data is used too. So that's what we're trying to change. And we're starting just a date.
When did you found the company? When did you found it?
2020 is when we first filed IP, and then my co-founder is actually my brother, which is fun. But we were both working. I was working another job for a year. He was finishing up the second year of his MBA program. Then we came back the summer 2021. So coming up on 2 years now, full time at Genial.
So you're creating essentially an exchange, a market, kind of an exchange for data, personal data, and in this case, it's starting with medical data. I can't help but think that the world needs this beyond that, in the sense that Google has all my data. Um, all the big tech has my data. My friend Phil Chang in Taiwan says that that's currency. That is, that's money that people should be able to sell their data. Um, you know, or beyond this, have you ever thought of? I mean, I know you got to start somewhere. Medical data is an obvious one. Have you ever thought about taking this beyond just that and trying to reclaim and giving people the ability to reclaim the information about themselves and how public it is?
We think about it a lot, and that's very well could be on our roadmap in the future. But, when there's such a big opportunity and so many exciting possibilities about the future, especially at our stage now, it's important just to kind of
Stay
remain
focused.
grounded
Yeah.
on our initial focus and to not get distracted. And when you're choosing between two good or multiple options that are all good, and it's not one that's inherently better than the other.
Hmm.
For me, it goes back to that personal mission statement that kind of keeps me and keeps Genial, our company, grounded as well. That's really become the focus of Genial as well, to help relieve human suffering by accelerating precision medicine through private exchange of biomedical data. But as we grow, I'm sure there's going to be opportunities to look at applying data exchange across industries too, which will be fun to see that.
But you probably get more resistance there than you would maybe. Just both parties are motivated in your scenario. The other scenario, would want to shut you down. Have you ever had any thoughts as it relates to quantum computing and the rise of quantum computing and its ability to or compromise encryption and all the things and security that a lot of this space would rely on? Do you have any thoughts on that? I'm always curious for those that are really, I mean, their business is focused on protecting confidentiality.
Yeah, we're thinking, how can we build this to be as future proof as possible? And to your point, quantum computing, does pose a very real threat of being able to crack a lot of the most commonly used encryption algorithms out there right now. Thankfully, and this new umbrella of privacy preserving compute, new encryption algorithms that are being developed through this, um, they do have their Achilles heel of being less efficient, and they need optimization still. And that's why they're not just instantly, everywhere and ubiquitous. But a lot of these new algorithms are considered to be quantum safe and are not expected to be able to be cracked by quantum computing. So, now that deep cryptography and quantum computing, disclaimer, that's outside of my technical wheelhouse, but that's that's what we're our perspective and our understanding about that. So.
Well, I always like to ask my guests what their most defining character moment was and how it affects them today. Does anything come to mind for you, Adam, as either personally or professionally that really kind of shaped who you are as a person today, how you are played a role in industry and as a CEO?
I do think of character as being the accumulation over time of consistent choices and deliberate decisions, making those hard decisions over time. I think so. For me, I think there's definitely been a ton of moments and trials and things that I've seen, but I do think one moment comes to mind, and I think going back to that personal mission statement, and I remember it was a mentor of mine at BYU connected me with a leader in the field of Alzheimer's disease research, and I he had just founded a company at that time, and I heard his story about his personal motivation behind Alzheimer's. It was affecting his family, and remember he used those exact words of relieving human suffering is really what motivated him in that. And that just really struck a chord with me. It was a thought that I had visceral emotional reaction, the moment that I remembered. And as I ruminated on it and that evolved, I really came to adopt that as my personal mission statement, just to add the focus on genetics. And that wasn't a challenge, but that was, I think that was a huge character defining moment for me, because it helped me establish my North Star, right, personal mission statement, which, leaning on that, is what helps me know what decisions to make when I am faced with those challenging periods. If you don't have your core principle or focus, and how can you decide really what to do in those challenging moments?
I love that. Adam, you've been such a wonderful guest and so thoughtful. And I am so grateful to know you. I'm really grateful that you're in this space, a thoughtful person like yourself in a space that could be, um, well, dangerous for humanity if it got in the wrong hands of folks. So keep up what you're doing. Is there anything that would be helpful for you in your business to communicate to an audience? Anything we can do to help you other than to cheer you on?
And so on our website, genial.com, that's GENEIAL.com, you can head over there. We have a form where you can sign up for our newsletter. There's also another tab where you can just reach out to us and ask a question. And if this is interesting to you, if anything that I've said, rare diseases are actually a very common problem. It's estimated 7% of the world has a rare disease, 80% of which are genetic. So, it's a big problem. It affects a lot of people. If this is relevant to you, we'd love to hear from you. And so feel free to reach out via our website, or sign up for our newsletter if you want to follow us on our journey.
So just to go on a tangent here a little bit. So said friend has this product problem. Is there any way they come to you and you play a role, or do there needs to be a doctor in between? How does that work?
Yeah, this is, Dan, this is such a really complicated problem that we're trying to tackle. And we need to be lean and build out the functionality of the platform kind of one step at a time. So having said that, eventually we absolutely will be at the point where there is where people who are undiagnosed can sign up through our app, share information which is kept private. But then that could be used to facilitate potential matchmaking, putting them and clustering them with other patients that maybe researchers on the other end want to say, oh yeah, I'm actually interested in looking into these types of things. So we'll get there, but at least for now, for the initial steps today, we're working with kind of a B2B2C model where there's established advocacy groups for people that do have a diagnosis. But even at least just from being patient centric is so critical. A lot of companies out there in the space say they're patient centric, but it's really a name only. We literally are building this around the needs of individuals and patients. So just from a discovery, understanding, perspective, kind of having empathy. We love to hear individual stories as well too. If you'd like to reach out and share your journey with us.
Okay, that's amazing. And then finally, I'm only interested in economics. How much do you want? How much will you pay for my data? I mean, I'm willing to give it to you, but you gotta, what do I get? $100 a month?
Yeah.
Yeah. I mean, that's another way to motivate people to participate, right? Like say, hey,
That's right.
give us your data and we'll pay you $5 a month. You can buy a latte, something like that.
Well, we could, since we're trying to set up brokerage, right? Eventually a private brokerage, the pricing thing is going to be interesting to figure out. There's a lot of these direct exchanges of data happening right now. And we've seen a range of prices that basically could be anywhere from, caveat too. So what's the value of a healthy, quote unquote, healthy person's DNA and medical record. It's at an individual level, it's actually very, very minimal. But on the other end of things, the cost of recruiting an individual to a clinical trial, especially the more rare the disorder is, be looking at ballpark $20,000, $10 to $20,000 to have someone signed up and recruited in a clinical trial.
So you're saying that this is actually a bizarre twist of fate that could eventually, the more sick you are, the more your data is worth, and you could actually generate more income, which would maybe help provide you a way out of your sickness eventually.
Yep. Yeah. I'm
That's so cool, dude. I mean, this is so awesome. I know you're just in the beginning stages of things and getting going, but I love it, man. You've planted a lot of possibilities in my brain as far as I hope we can stay in touch. And I'm so happy you're not in academia, Adam. Stay in the industry and be good. Okay.
all right. All right. Thanks, Dan. I love what you're doing too. So
All
thanks for
right.
having me.